chiropractic for my horse.
Good evening. Quick show of hands. How many people have never seen a chiropractic examination? Just about everybody. So that's a good representation for Lexington. We have the most incredible athletes in every discipline in this town. And so you're starting to see all these modalities, laser, chiropractic, acupuncture, all used. And what is I'm going to skip through because we're lacking time and you guys are all well versed in chiropractic, what we're doing here. But our main goal is to maximize athletic potential. So that's what we're trying to do with all of these elite athletes is we want to see what can we do to push them to 110%. So what are we going to do to make that happen to get you to enhance performance, maintain soundness, increase your normal range of motion. Going back to the question, what are we looking for? We're looking for reduced performance, abnormal posture, any kind of change in behavior or the way the horse carries itself. I rely on all of my trainers and riders to kind of tell me what they're seeing. So you're going to see imbalances, you're going to see gait abnormalities. The horse is throwing me out of the seat just a little bit one direction. We're riding the rein to one side. These are all indications that we might have a primary back problem that we can look at that might help increase the athletic potential here. Anything that's going to throw the spine off. Shoes. If you and I walk in a cowboy boot in one boot, one shoe, and then a athletic tennis shoe in the other, it's going to throw your whole pelvis off. Anytime you have any kind of changes in shoeing, you have the potential to throw off your suspension bridge up top. Saddle fit and age. Obviously, with age, you start losing that range of motion. All of these are indications for good chiropractic exams. I've kind of gone through some slides here of just patterns I see with different disciplines. With your dressage horses, these riders are my best because they know exactly what's going on with their animals. They're having trouble working long and low. They're having trouble collecting. They don't want to bend. They just want to hollow their back. They won't get rounded up for me. I see polo horses that these riders need to stick like glue to these horses. And the riders are always saying, well, when I'm trying to lean, I'm trying to get a bend, and they become unseated in the saddle. A lot of jumpers and eventers in this area. We get bad engagement. We'll see shortening of the stride in many legs. The horses will pull against the rein, or they'll want to avoid jumps or land in the cross canter. Driving horses, we'll see them ride the rail where they want to get off track, meaning that their front end and their back end is not riding the same directions here. Usually leads to a lameness of some origin. And any lameness in the leg can lead to a back problem. If we carry ourselves just a little off anywhere down low, it's going to affect the entire suspension bridge up top. Western horses, I see all kinds of upper limb issues. I see shoulder issues. These horses need to get down. They need to be able to really, if anybody's ever watched a reiner or a cow horse and seen what they do, it is amazing the range of motion they're doing, and anything we can do to increase or decrease any pain that we see in these horses is going to increase their athletic potential. How many treatments? This is kind of a tough question, and kind of my take-home message from this is a lot of times I get called for, okay, I've got a horse that's fixated or he's doing one thing or another that is painful. Realistically, chiropractic medicine should be used more preventatively is what I'd like to see it happen. So I get calls to try and fix things or only when the horse is hurting itself. When in all reality, we should be maintaining the spine all the way through the life phase, but specifically the earlier they are in birth, the more range of motion I'm going to get out of these horses, and the more you're going to maintain the health of those vertebrae going forward. You get these older horses that start getting fixated and get decreased range of motion. There's a lot less that I can do with these horses at this stage. So we want to maximize it earlier on, but treat it like preventative medicine and less like a treatment. Questions?